Hi, my name is Atif Darush, professor and consultant of obstetrics and gynecology. In this short video, I'd like to show you the idea of plasma edge mini-resectoscopy and how to install it. We know that mini-resectoscopy is a concept of using a resectoscope but of small caliber. In this plasma edge resectoscopy or mini resectoscopy, we use 15 French outer diameter of the resectoscope, which is 5 millimeter outer diameter, which is too small to allow this resectoscopy to be used for outpatient or office hysteroscopic surgery. And actually, the plasma edge relies on a bipolar plasma energy generator idea, which is a little bit different from bipolar energy generator in having the precise uh, energy supply to the edge of the instrument. And it uses full electrode range, and the working element is too delicate that allows the insertion of the 5 French electrodes, and by the plasma edge mini resectoscopy has a unique idea of being not using the sheath as a return electrode with bipolar, but the current or the return electrode is inside the working element, so there is no communication between the electrode and the outer sheath and the patient, of course. By this way, there is confined energy delivery, which is more safe if you are using it inside the uterus, particularly nearby Darwish triad, which is the corneal end of the uterus, to avoid damage of the tube. In this short review, you can see how to install the instrument. This is the working element, and you insert the electrode, and it's 5 French electrode is inserted into the bridge, fixed in 3 parts. By this way, the plasma edge mini resectoscopy has been loaded, and you can insert it into the cervix, and with saline solution, of course, because it's a bipolar, it's plasma bipolar energy, and with distinction of the cervical canal, you can go inside the cavity and see properly what's inside. This case, for example, is a good example of how to use. Here is a polyp nearby the tubal ostium and nearby Darwish triad. If you use the monopolar diathermy, there will be damage of the tubal ostium. And if you use the usual or conventional bipolar, also there is a risk of spreading of the energy. But using plasma edge technique is important to preserve the fallopian tube and to avoid any possible damage by spreading of the energy and heat to the very delicate part of the fallopian tube. By this way, you can use the plasma edge mini resectoscopy in selected cases of infertility, of course, and who are at risk of damage. And of course, it's associated with less risk of perforation because the bipolar energy is confined to the edge of the instrument and there is less risk of perforation. So these are the important implications of not using GCs as a return electrode, improving safety, low risk of unintentional thermal injury to the surrounding tissues, particularly bladder, cervix, or endometrium, or fallopian tube, as the return current is localized and controlled, more precise energy delivery concentrated at the edge or at the tip of the instrument with less dispersion of energy, improving section accuracy, especially near the delicate structures, as I already mentioned, Darwish triad, reduced sticking and charring, and this is important for proper visualization, less tissue sticking to the electrode, more efficient vaporization and cutting, and less liable to perforation due to precise plasma bipolar energy at the edge, due to the smooth dissection and high visibility due to the less air bubbles and less charring. So this is the idea of using plasma edge mini-resectoscopy or plasma edge concept in bipolar energy. And I wish to show you this new advance in hysteroscopic surgery. Thank you.